And welcome into To Your Health. All this month is National Heart Month, and we've had the pleasure of having with us Dr. Elizabeth Jackson, who's a cardiologist and a professor at UAB in Birmingham. Today we're going to be talking about if you're having some problems with your heart, some of the things that can be done to treat the problems. Well, Dr. Jackson, last week we were talking about the fact that obviously one of the big problems you can have with your heart is it's going to cause it to have a heart attack. Well, when you're starting to, even before the heart attack hits, there's different things if you're doing regular appointments with your doctor, and especially with a cardiologist. I think that when a person gets to a certain age, they need to be referred to a cardiologist to be able to look a little bit deeper and see what can be done. So we talked last week about different things that are causing the heart to have problems. How do we correct these things?
Great question. So, you want to know, are you at a risk for having a heart attack? Unfortunately, as we age, there's more heart attacks in older folks, older adults, than there are in younger. We've had more time to accumulate plaque in our arteries, including the coronary arteries. What you can really do about it is work with your physicians. As a cardiologist, I always see myself in a team-oriented sport. So I'm part of the team with the patient and with the primary care provider.
Mm-hmm.
We all want to know, any risk factors present, and are they well controlled? If their blood pressure is elevated in the past, they have a diagnosis of hypertension, how well are we all controlling the blood pressure now?
Mm-hmm.
Same thing for diabetes, same thing for lipids. And obviously, if someone's smoking, we want to help them any which way we can get
Stop.
them to stop smoking, because it is a very, very, very strong risk factor for coronary artery disease, and also artery disease in your head and your legs and everywhere else.
Mm-hmm.
Not a good thing. So really treating risk factors, things like being on a lipid lowering medication like a statin or cholesterol medication, we know that even if your cholesterol is not super, super high, that can really help lower your risk significantly for having a heart attack, or if
Mm-hmm.
you've had one, having another one. There are amazing advances not only in lipid lowering medications, but in diabetes medications as well. And the same thing goes for hypertension. So we have a suite of medications that complement what a patient is doing in lifestyle modification, and working together so that we're all on the same page of what the goals are, can really help lower your risk of having a heart attack. And again, if you've had a history of heart disease, lowering your risk of future heart disease or heart failure.
Mm-hmm.
So it's tremendously important to, make sure that your team is all there and you know exactly what the game plan is.
Who's doing what, right?
Yes.
At that point. And of course, obviously, then there can be open heart surgery. There can be
Yes.
just putting in a stent. There's different types of things that can be
Yes.
done, but they have to be done early on, don't they?
Well, so if somebody, let's say, has come in, they've just had a heart attack, they're often frequently getting right into the cath lab and looking at the major arteries that feed the heart muscle with oxygen. And if there's something that's amenable right then and there to be corrected, then the interventional cardiologist oftentimes opens it up with a stent.
Mm-hmm.
Sometimes people can have blockages in lots of places, or in places that would be amenable for bypass surgery, and then talking with the CT surgeon, and sometimes going to surgery right away, sometimes taking a little breather, healing from that heart attack, or making
Mm-hmm.
sure other conditions are fine, and then going to bypass surgery is the best thing to do. So you want people to have the right treatment at the right time. And sometimes that can mean bypass surgery. Sometimes it can mean stenting. And
Mm-hmm.
your cardiologist, if you have a general preventative cardiologist like me, they'll be working with the interventional cardiologist and the CT surgeon and the patient to make sure that the right sequence of event, treatment is happening for them.
Mm-hmm. And of course, you first start again, like you say, by prescribing maybe some kind of a medicine that can address the problem. And if it's not working from that perspective, then you have to get a little bit more aggressive.
Yeah, sometimes that's really true. We know that a lot of these medications that help us reduce or attenuate or treat risk factors are very good for the heart. So
Hmm.
chances are, if you have heart disease, coronary artery disease, you're going to be on a suite of medications. We try to make it not be everything, only the ones that you need at the doses you need. But we know for the majority of people, really, being on medications to help them with their blood pressure, being on medications to help them with their cholesterol and potentially glucose or for diabetes as well. Some of these medications are good for the heart muscle if the heart muscle has been damaged and is weaker. And then we think about that being the case of heart failure. So there's really a tailoring of
Hmm.
different medications to fit the patient's needs, depending on what's been going on with them and what their risk factor is going in the future.
You need to bring it all together, like you say.
Yes,
Yes.
yes.
Well, I'm going to have you come back next week because I know this is going to be the hot button for you, how we're going to maintain this healthy heart. Okay, we'll be back right after this.